a couple of facts about American healthcare. We spend more in the United States of America on healthcare than any other nation in the world. Approximately $10,000 per capita, per head, in 2016 for healthcare. And we have some of the poorest outcomes in the world. We rank 30 in outcomes for preventable diseases like obesity, hypertension, diabetes. 30. The gross domestic product, which is, I have economists in the room, so they can help me with this, but it's the sum of everything we produce and every service we provide. That's the gross domestic product. It's a measure of our economy. By 2020, we will have the percentage of healthcare percentage of the gross national product will be 20%. This is an enormous amount of money. Right now, in 2016, healthcare costs this nation $3.3 trillion. I cannot conceive of the zeros that are in a trillion. That's how big healthcare is. And yet, we rank 30th in life expectancy. Japan is number 1. More Americans die of poor healthcare quality than any of 11 countries studied. The countries were Europe, United Kingdom, Australia. And poor access to primary care, that's the prevention piece. That's the piece we don't think about, right? That's the piece I wasn't thinking about when I was falling on my leg every day for 3.5 weeks at an age where nobody should be doing that. Poor access to primary care in the United States has contributed to inadequate prevention of chronic disease and increased mortality. Who is paying for all of this? Who is paying for all of this? There are 2 philosophies on how it should be paid for. They appear to be polar opposites, but both of these perspectives are based on a philosophic approach to life and deeply seated moral values. So I'm not here to talk about what is right or what is wrong and who holds these opinions. But broadly stated, there are two poles on this notion of who should pay. One philosophy, which is based on utilitarian arguments, says we're going to balance the needs of individuals and society. That healthcare is a right, an equal right for all people, and that universal coverage, that means every human being in the society should have healthcare coverage. The best example of this in the United States of America is Medicare. Every American, when they turn 65, is required to enroll in insurance coverage, which is called Medicare. It's government insurance. That is every person who's 65 to death, that is your primary insurance company. Medicare pays 80 cents on the dollar for all healthcare dollars. The 20% is the responsibility of the individual. Now, I have made that so simple, and if it was that simple, it wouldn't be an issue. But let's just use that as a model. So the individual is responsible for 20 cents on the dollar. Medicare pays 80 cents on the dollar. And you know what? It works. It works. It's complicated, but it works. That's the best system we have that would even mimic universal health care in the United States. A different philosophy, which is very American, a different philosophy says individuals should be empowered to handle their needs, that individuals should compete, that systems should compete, that health should be taken care of by individuals in a free market, and that individuals should be able to pick and choose healthcare plans and make decisions on how they should be covered based on that competition and based on those decisions. So one philosophy takes a look at universal coverage, the community, and people together take care of coverage. The other extreme says individual empowerment in a free market. We have a little bit of both of that in our country right now, a little bit of both. So is health care a human right? I think so. Who pays for it? I put that question to you. And as we do, I'd like you to consider the following. If healthcare is a human right, is it also a human responsibility? What type of health care do humans have a right to? Andy has an interesting experience in another country that has universal health care that I'd like him to share with us. What do other nations that have lower costs and better outcomes do that we don't do? And does it work in those nations? Given the political climate in the United States, where should these conversations be held? And finally, who has the responsibility? Who? For assuring this human right? Who has that responsibility?